There's two areas of, especially the lower part of the face, where we really haven't had great things to offer patients. Lisa is getting a bit jowly. She's starting to see a little bit of laxity here, and she does have a bit of ptosis on the upper eyelids. We can go right into here and sort of tighten it. It's a problem area that we haven't really been able to address till now, non-surgically. Now we have this Ulthera, or Ultherapy, as it's been coined. So it's FDA approved in the States for non-surgical lifting and tightening of the skin. And it's exciting because the traditional skin tightening procedures that we had only deals with the actual skin. So you're trying to tighten the skin. So what's great about this is Ultherapy is an ultrasound, and it can go very deep. So we can go down to the deeper support structures of the skin and tighten those, which is really in the domain of surgery. What you're doing with the ultrasound is you're heating the tissues. So you know when you heat something or fry something, it contracts. So you get this immediate result, which is really neat. You can see that it's tightened and lifted. There is some evidence that you're getting some new collagen production by actually heating things up and making the collagen work again, and new collagen. We see the patients back in 3 months, and we see sort of a sustained improvement in tightening and lifting. So the fact that it's reproducible, it's no downtime, and most patients will be okay with one treatment. The optimal results are skin lifting and tightening, and we usually always say like moderate improvement. And there is always, I'm finding this more than anything else, it's consistent improvement.
Okay, thank you. So Lisa is in the audience. Let's see how Lisa looked before. This is Lisa's before shot. Okay, and now let's see Lisa. She's sitting in the audience. There she is. Please welcome Lisa. You look great. You're glowing. So tell me, how was everything? Like, first of all, did it hurt? I like asking that question.
A little bit.
A little bit, yeah.
It stung at points.
Yeah.
Particularly where it's more bony, so along the jawline, it was a little painful, and the eyebrows.
Lisa, did you see the results right away, or did it take a couple of days?
I noticed some results right away, but I've noticed it's been about a week now, and every day I see better results.
Yeah, and would you do it again?
Absolutely. And
how often to do that? Like, how often did the doctor say you have to come and see her?
I understand that the results will continue to improve over 3 months.
Over 3 months, okay.
They said, 3 years, you might want to consider it again as you lose more.
So you're pleased, because you look great.
Absolutely.
Yeah, you really look good. So,
I was thrilled.
Not completely painless, this procedure.
Right.
So tell us a little bit more.
Also a little bit longer treatment. I think an hour or so to start of freezing, and then an hour to the treatment. So, I mean, you can understand it's taking a little bit longer, but for results that last for 3 years, and again, Lisa's face, his skin, it just looks amazing.
No, it does look amazing.
So refreshed.
It really does. It does.
So,
how much? How much is this going to go?
$4,500.
Okay.
So a little
what do I
bit
get for that? What do I get for all that?
But I think a natural results. Again, no one is going to know that you've done something. You don't have the downtime. Lisa said she could have gone back to work the same day.
Yeah. So it's an accumulative kind of thing. Yeah. Okay. So the procedure, when you pay that amount of money, that's for a long-term kind of
over 3 years,
over
right?
3 years, yeah.
And maybe even longer. You don't know.
So who's the ideal candidate for this?
Anybody with some skin laxity. So once you're starting to see that, maybe around the jowls or your neck that is starting to hang a little bit, that's a good time to start to maintain. So it's just like anything, going to the gym, right?
Yeah.
Instead of waiting until you're like, oh, now I haven't worked out in 20 years.
Yeah. No, I think I'm going to do that. I hope there's a change.
Yeah.
Okay, so very good. So that's a new therapy that I'm not familiar with. Next, we have Andrea, who had a treatment called the Eterna. Tell us a bit about that.